Types of obsessive-compulsive disorder. There are 5 main categories of OCD. Number 1. Contamination. Number 2. Ruminations. Number 3. Intrusive thoughts. Number 4. Checking. Number 5. Hoarding. Contamination. Here, an individual's fear of contracting something is the obsession, and their need to wash and clean is the compulsion. Individuals with contamination OCD are preoccupied with fears of illness, germs, and dirt. Usually, they can spend hours thinking about these fears on a regular basis. Examples: resorting to washing and cleaning excessively when using public toilets, shaking hands with others, touching doorknobs, handles, visiting hospitals, etc. Fear of contracting germs, cleaning or washing is often undertaken multiple times throughout the day. It often is accompanied by rituals of repetitive washing of hand or body until the individual feels clean. In severe cases, they may even avoid their loved ones too. People with contamination OCD also seek the reassurance of other people, repeatedly asking for confirmation that something has been cleaned thoroughly or not. Ruminations. Here, an individual often experiences prolonged thinking about any question or theme, which leads to being mostly unproductive and undirected. Ruminations are often indulged and not objectionable, rather than resisted. It happens in all forms and subtypes of OCD, in which an individual engages in long periods of time persisting on the topic of their obsessions, like contamination or mental checking. It can happen to anyone, regardless of age or gender, and may appear a lot differently in different people. Intrusive thoughts. Do you ever have intrusive thoughts coming into your head, impartial and apparently from thin air? Here, an individual experiences obsessional thoughts that are repetitive and repugnant in nature. Intrusive thoughts may be violent or disturbing in nature. They may be thoughts of a sexual nature, including fantasies. Moreover, these are not warning messages or red flags, but merely thoughts. They can also be about behaviours or fantasies that are considered unacceptable and abhorrent. For example, thoughts of causing harm to others or loved ones. Checking. Here, an individual's fear of harm, loss, or death is the obsession, and the need to check is known as a compulsion. Checking of gas or electric stove knobs, fear of causing a fire, water taps, fear of flooding, door locks, fear of robbery, emails or text messages were written with errors, etc. Hoarding. Here, an individual's inability to dump or trash purposeless or worn out possessions, save or collect things even when they have no space to keep, is known as hoarding.